Have you ever heard a faint humming in your ears, only to realize it was coming from inside your own head? That, my friend, could be the subtle roar of hypertension, better known as high blood pressure. It's like a party going on in your arteries, and everyone's invited. Now, before you start picturing tiny people doing the conga line in your veins, let's get serious for a moment. Persistent high blood pressure can damage your arteries over time, increasing your risk for serious health problems. So, what causes this pressure cooker situation in our bodies? Well, it's a bit of a mystery sometimes. For many people, the exact cause of hypertension is unknown, a medical head-scratcher we call essential hypertension. But don't worry, we're not completely in the dark. There are several factors that can contribute to high blood pressure, some within our control and some, well, not so much. Age, for instance, is a big one. As we get older, our blood vessels naturally tend to stiffen, like a garden hose left out in the sun too long. Genetics also plays a role, so if high blood pressure runs in your family, you might be predisposed to it as well. Think of it as a family heirloom, though this one you definitely wouldn't want to inherit. Here's the tricky part about hypertension. It's often called the silent killer. Why? Because in its early stages, it usually doesn't cause any noticeable symptoms. You could be walking around with sky-high blood pressure and feel perfectly fine. Sneaky, right? This is why regular checkups are crucial, especially as you get older. Think of it like taking your car in for routine maintenance. You wouldn't wait for your engine to seize up before changing the oil, would you? Now, while most people don't experience noticeable symptoms in the early stages, hypertension can sometimes manifest in subtle ways. These symptoms can be easily mistaken for something else, which is why it's important to be aware of them. Headaches, especially throbbing ones in the morning. Nosebleeds, not the kind you get from picking. Facial flushing. Dizziness or lightheadedness. Fatigue. If you experience any of these symptoms, don't panic. It doesn't necessarily mean you have high blood pressure, but it's definitely worth getting checked out by a healthcare professional. Remember, early detection is key. Section 4. Taming the pressure. Treatment options for hypertension. So you've been diagnosed with hypertension. What now? First, don't fret. It's a very manageable condition, especially when caught early. The goal of treatment is to lower your blood pressure and reduce your risk of complications. Your doctor will work with you to develop an individualized treatment plan, which may include lifestyle modifications and/or medication. Think of it like a personalized recipe for healthy blood pressure. Lifestyle changes are often the first line of defense and can make a big difference in managing hypertension. These include eating a healthy diet low in sodium. That means putting down the salt shaker. Maintaining a healthy weight, getting regular exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Quitting smoking, seriously, just do it. And limiting alcohol consumption. Section 5. Your health, your priority. Seeking professional guidance. Remember, this is just a general overview of hypertension, and the information provided here should not be considered medical advice. It's crucial to consult with your healthcare provider for personalized guidance and treatment options. If you're experiencing any symptoms or have concerns about your blood pressure, don't hesitate to reach out to your doctor. Early detection and management are key to living a long and healthy life. And hey, if you don't have a doctor or are looking for an affordable and convenient option, check out MyHomeDoc Telehealth at www.myhomedoc.care. Stay tuned for more informative and engaging content on various health topics. Don't forget to like, subscribe, and share this information with your loved ones. Let's all work together towards a healthier and happier tomorrow.